Thank you very much, and thanks for the invite. I was delighted to be appointed on the 1st of July because up to that point in my career, most of my appointments have been the 1st of April. And people made their own interpretations of that particular date. Look, it's really great to be here today. The Antibiotic Stewardship Forum is a really important event in our annual calendar, and I think it gives us a great opportunity to share some of the work that we've been doing over the past year, but also a chance to re-engage, reaffirm the need to make progress going forwards and actually keep us honest in terms of effort. So make sure that we keep our foot to the pedal so we've got something to report back on next year. In many ways, talking to the converted today, but there's an awful lot of converted out there. And one of the points I make to my staff regularly is what other area of our work is actually discussed by world leaders on a regular basis. And the reality is, not many, but antimicrobial resistance, as we've heard repeatedly today, is a world issue, and there is huge engagement at the very highest levels of government in terms of making progress on this particular issue. And just as recently as this year in Hamburg, the world leaders agreed to very much a One Health approach to this problem. And I'd like to think that we certainly have moved on from the old days of recrimination where different professions blame the others for all the ills. This is a complex problem that is multifactorial and needs to be addressed by a huge range of stakeholders, not just the medical and veterinary profession, but obviously we've heard already the wider public has a role to play in terms of managing this, and of course agriculture and the pet keeping public also have roles in terms of understanding and managing this issue. And as we've already heard, many of the world leading organisations such as WHO, OIE, FAO and indeed the EU are really seriously tackling this issue. So Mark's talked about the national AMR strategy. Like Brett, I'm fortunate enough to sit on ASTAG, and I think it's been a fantastic forum of bringing the various interests together. I think we can learn from each other. Much of what we do is directly applicable in our different spheres. We've been doing considerable work in AgVic over the last year, particularly under the first objective of the strategy in terms of producing communication materials, and I'll share some of that with you. But we've also been undertaking a lot of work with our various communities out there, so the farming profession, the veterinary profession, and representative bodies to try and spread these messages more widely. So some of the material that we've done, it's not there, here we go. Mark showed you the website that we've got. I would encourage you to look at the website. We've put a lot of effort into developing materials that are downloadable and readily shared across the piece. And some of this materials here, we've also produced, we know lots of people like takeaways at shows and fairs, so this is a copy of one of the fridge magnets we produced, because I know there are avid collectors of fridge magnets. Now, if there's any avid collectors here, I've brought a whole load of them at the table at the back. So if you want to take away some fridge magnets, please feel free to do so today. Again, different audiences, really important to target the different audiences out there and providing evidence to bust some of the myths that we heard about on the human health side earlier on. So just as human patients suffer from illusions and false truths, so do animal keepers too, and we need to actively address those. So this is just some of the material that we've produced across the board, and as I say, please look at the website, it's all available for you there. So looking at what's happening in Australia, Mark's touched on this already, but I'd like to go into a little bit more depth into some of the reports that have been produced. So as Mark had said earlier, we don't historically have a huge antibiotic usage in farming, the farming sector in Australia, and we have various checks and stays in place to keep that as the current position. But of course, we also have to make sure that the pressure for antibiotic use doesn't grow, and that means including a number of strategies, including increasing farm health planning, and there's a lot of work being done on that through the assurance schemes in Australia at the moment. So having effective farm health plans does enable you to put in place husbandry and management strategies that reduce the likelihood of disease. And again, we've heard earlier that the pastoral system in Australia in the cattle and sheep sectors particularly lead to a low uses of antibiotics, and that's absolutely the case. When I worked in Scotland, our cattle and sheep, well, certainly the cattle, used to be housed for at least 6 months of the year. And when you're keeping animals in that sort of close proximity, it does lead to rapid spread of diseases, particularly enteric diseases and pneumonia. So we're lucky in that respect that we don't have those particular problems. But as I say, we've got to make sure that the drivers remain to keep that situation constant. Can we do more? Of course we can do more. As I say, there's the farm health planning side of things. We've heard of alternative therapies like phages. In my particular unit, we actually run a pig services centre in Bendigo where we're producing autogenous vaccines for the pig industry. All of these are important ways that we can manage the dependency on antimicrobials. So the second study that I wanted to point to is that there is a lot of evidence out there that we don't have high levels of antimicrobial resistance in the farm sector or to some of these important organisms for human health. And then the third study again reinforces that. That we to date have been fortunate, but as Mark indicated, we can't be complacent. Certainly resistance patterns can change very quickly. Hopefully we can manage the use of the levels of antimicrobials, but resistance can change. So can we do more? Stewardship, definitely. We need to continue to work with our veterinary colleagues in the profession and, as I say, the wider client base to ensure that this issue is taken seriously. Now I'd like to turn to some research that's being done in other parts of the world, and this is some work that was done in Holland, and it's really important, I think, because it used to be 10 years ago, 20 years ago, we didn't really refer to social science and the way that people's minds work. And the reality is that many of these problems are about the way people think and perceive problems. So this work in Holland really just demonstrated two truths that are out there, I guess, and that most of us have taken second nature now. And that is, firstly, people need to believe that there's a problem. Unless we can convince people out there that there's a problem that needs to be managed, they won't engage. And then they have to buy into the solution. So the solution not only has to work for the problem that we're managing, but it also has to work for the industries and people that are using them. So just providing a blanket ban for a mechanism of managing animal health is not going to be a popular way forward. We actually have to find subtler ways of managing this very real problem. So another piece of work I'd like to refer to is that done by Scott McDougall and his team in New Zealand working with the dairy industry. And again, it really builds on that Holland study, and it suggests that that really change needs to be based on knowledge. People need to understand the problem that they face. And then we've got to change attitudes so that, as we saw on the previous slide, people take ownership. They've got to be skilled up and have the skills to be able to provide alternative strategies. And I'll give you one example here in the animal health sphere. Although it's really to do with helminths and not bacteria, it's very relevant. So we have a problem with anthelmintics relating to liver fluke. There's really only one that's efficacious, and resistance is going through the roof. How did we manage before we had anthelmintics? Well, we understood the life cycle of the liver fluke. And we understood that there was an aquatic snail that was an intermediate host. And if you actually didn't keep the cattle in contact with the intermediate host, you could actually manage the level of disease in that way. And increasingly work is being done at La Trobe and Agribio here in Victoria to actually work on that old understanding for management techniques going forward. So in our irrigation areas, there's now work that demonstrates if you can actually set aside those parts of the pasture that are adjacent to the irrigation channels for hay production or silage production and keep the animals from actively grazing, then they don't acquire the helminths in the first place. Therefore, you don't need to use the anthelmintics to control them. And similar strategies can be employed with many of the bacterial diseases too. And of course, also in terms of aspiration, people need to understand what's in it for them, and I'll talk a little bit about that in future slides. And in terms of communication as well, one of the big lessons from this study is you need to tailor the communications to the community that you're speaking at. So they're very different messages that you need to employ for the different communities. And I think that's what we've been trying to do here in Victoria over the last year. So, you know, many of the challenges for vets are similar to our medical colleagues. So veterinary practitioners are under pressure from their clients to prescribe antibiotics. It's seen as a quick fix and a cure-all. And of course, unlike the human population, although we recognise there's an economic cost to human illness, there's a direct implication for the bottom line of businesses if they get disease that they can't treat. And of course, they can be very high, particularly for the pig and poultry industries, where you have large numbers of animals in close confinement. So people need a way to manage disease, but we cannot have a situation where people are using antibiotics to mask poor husbandry or poor infrastructure, and that's where we can actually manage, as I say, many of these issues through appropriate techniques. And of course, we don't have Medicare in the veterinary profession, so you know, the full cost of any isolation of bacteria and culture of bacteria and sensitivity testing falls on those owners. So again, it's very easy in principle to say you should do all this work, but there is a direct financial cost to them. Now, other countries, and I certainly had experience in the UK, took an approach with the veterinary profession of trying to reduce the reliance on drug profits to try and drive positive change. Because the practice model in the UK, and very much so here in Victoria too, was that the vets actually charge very low amounts for their professional consultation fee, but they get their profits from turnover of drugs. And of course, that's a direct driver to increase drug usage. So what we tried to do in the UK was very much discourage that, and it just illustrates a story that professions always need to consider consultation documents very carefully, because the consultation document that was sent out in relation to this particular initiative suggested that veterinary practitioners should issue prescriptions free of charge. And of course, the profession didn't look at the consultation document, and then once it was implemented, suddenly realised they were being asked to provide their professional services free. So a statutory lesson to everybody. But the idea behind that was that every vet, when they had a consultation, had to issue a prescription, so that the owner had the choice of either buying the drug from the vet or going to the local pharmacy. And additionally to that, we actually required veterinary practices to publish the prices of their 10 most commonly prescribed drugs, so that people could make a direct comparison. Now, there are some issues for that. So it's all very well if you've got a moggy in Coburg or somewhere like that, where you've got a pharmacy just down the road. But very different if you're a farmer in the remote Mallee, where you've got animals that need immediate treatment, and the thought of taking a prescription to some pharmacy that's umpteen kilometres down the road is not really an option. And there are, you know, practical problems with that approach, and there are, of course, animal welfare problems in terms of the availability of drugs to treat serious conditions, and of course human health issues in terms of zoonotic disease that isn't treated, both for the people who keep the animals, but obviously through the food chain too. So it is a complicated issue, that's for sure, and I don't think there are any simple solutions. But in terms of what's in it for me, we've got to be very clear about the messaging. And look, I mean, the message about long-term availability of antimicrobials is fabulous, but you're a 58-year-old approaching retirement. You know, what vested interest have you got in terms of having antibiotics 20 years down the line for treating your animals? So I think we've heard of some of the more relevant drivers already. So increasingly there's a demand from the public for residue and antibiotic-free products. And I think tied in with that are a lot of the assurance schemes that we have in the agriculture industry that are demonstrating reduced reliance on antibiotics, and that's being driven by consumer demands. And of course, don't forget, medication is expensive. You know, so pig farmers, poultry farmers are not going to put huge amounts of medicine into their herds and flocks if they don't require. So again, education about alternative strategies that will not just result in improvement for that particular batch of animals, but continuing improvement where the investment pays off long term is a more viable approach. Again, the administrative burden, so there is a lot of administration associated with the use of antibiotics, so again, cutting down use reduces that. And I think there is for the vets in particular, there is a really strong message here about valuing their professional expertise, that vets should be charging, as should medics, for the expertise and advice that they issue, rather than the drugs that they prescribe. So coming to an end, what are the opportunities? So I think one of the things I tried to do in a previous role and look to in Australia too is for the veterinary profession to take on a much more holistic role. So for many years, particularly in the agricultural centre, the veterinary profession is seen as a fire brigade service, going in there when there's an emergency, when there's an animal in distress, and trying to sort it out. Whereas I believe that the veterinary profession needs to move to a much more preventative approach and should be involved with farm health planning, and should be working with other disciplines such as nutritionists and engineers in terms of developing systems of farming and animal husbandry that actually manages a lot of the problems out of the animal sector. And actually I think that would be a far more rewarding job for vets, rather than just going in and actually treating these emergency cases. So I think, to me, that is key in the profession in terms of change of thinking going forwards. Now, I did mention that we've done a lot of work over the year, and during the year we've attended a huge amount of events across Victoria. Some of them are for wider industry. We've attended sheep shows, dairy shows. We've been to the AVA congresses promoting this responsible stewardship of antimicrobials, and that effort will continue over the coming years. So basically, just to crack on and finish, because I think I'll probably use my time chair, it's recognised as a global crisis. There's no question the antimicrobial issue, but I think it is not someone else's problem. It's very easy to say it's a world leader problem. It's everybody's problem, and we need to work actively at doing this. We don't have a big problem of antimicrobial resistance in Australia, but as we've said before, we can't be complacent. Let's keep it that way, and that takes a huge amount of time and effort. We are committed in the work that we're doing. We will continue to work over the coming years, and we look to sharing our work with you next year. But importantly, we've got to tailor the messages so that people see the value to themselves of what we're trying to achieve. And we need to continue to support those wider communities in actually delivering those outcomes. So thank you very much.